Marigrace Randazzo-Ratliff, a substance abuse psychotherapist, with us on the Oakland County Megacast. Thank you for being with us today.
Oh, you're so welcome. I'm excited to be here.
So how are you? How have you been during the pandemic?
Well, our offices are busy. In fact, they're predicting mental health will be the next pandemic, actually, because the need is going up so high, and the fear of not having enough, therapists available is a big concern. So right now, everybody's, getting involved in the latest data and trying to prepare to be available for those people who need it.
Do you find that during the pandemic, with the changes that your practice and other psychotherapy practices have had to undergo, that it's tougher to treat your patients because you're not having that in-person one-to-one interaction, or is it about the same or maybe even easier?
I think it's both. I think it's different. And I think what makes it hard is when things are different, you have to go through a transition. And so getting through the transition is stressful. And I think everybody's been hit with so many transitions during this pandemic that it's just been stressful. But we can give people support and help them to understand what is going on with them, because it's the hardest place is when you don't know why you're so upset or stressed out or drinking too much. And the key is to keep educating people on what's going on with them and to not be afraid and to be there for them, whether it's via Zoom, teleconferencing, Doxy, whatever it is, that we are there for them and that people don't isolate, because isolation is at the core of poor mental health.
Just how much of a toll during this pandemic, as people have been stuck at home and they haven't been going out and they haven't been interacting with people maybe as much as they have before, at least in person, in that kind of an intimate situation, just how great of a toll has the pandemic taken because of that on people, because of that sense of isolation?
Yeah. It's taking quite a toll, because I think people were so shocked and scrambling, and they got, they had to really focus on all the changes they had to make, working from home, losing their job, the family being on top of one another, kids not going to school, those outside structures not giving relationships a relief, individuals a relief, from, going to the gym or not having the kids for 8 hours. When those structures all needed to close and everyone had to come inside, it increased stress and tension in the family and in the individual or in the relationship. And when all these transitions happen so quick, people go into like an automatic pilot and are shocked. And so when that shock wears off, they find themselves feeling stressed, uneasy, uncomfortable, and not quite clear why. And so then they start acting out that stress, whether it's yelling at the kids, yelling at the spouse, getting controlling, medicating, drinking. They will begin to act it out. And everybody's been in the house and on top of one another. So that just keeps getting all of the stress intensified. And so the yelling gets worse, the drinking gets worse over time. In substance abuse, which, is really key to talk about today, and I was so glad you guys were doing this, that isolation it's deadly. It's the worst thing you can do. So it's about transitions for family members, for adults, for kids, that we have to think outside of the box so that we don't isolate and we stay connected with other people. And we not only stay connected, but we vent our stress. We talk about it. And to say to somebody, wow, this pandemic sucks. It just does. And to be able to get it out so that you don't act it out. And that's what has been happening for a lot of people.
And these situations can have severe effects in normal scenarios and in normal times, and they snowball over time if they're not addressed. In a situation like this with the pandemic and all the added stresses that this brings, how much quicker does it take to get to that point of extreme severity where things can make a really murky turn?
That's such a great question, and it's quick now, because as the body, if it isn't dealing with it, if it isn't sharing it, you're absolutely correct. It snowballs and it intensifies. And right now, with this extraordinary situation, it's gotten really intense for people. And that doesn't allow you to have very much room to tolerate any little added stresses that are happening to you. And so it's gotten pretty intense for a lot of people. Substance abuse right now is really a serious issue. This pandemic, let me just quote something that I just read. There's something that's happening, and it's called, we coin it, the term is death by despair. And right now, death by despair is the highest number that it's ever been in history. And death by despair is something like acute alcoholic poisoning events, where somebody has drank so much they drank to the point of death. This is at such a rise and such a serious issue that it is in that category of death by despair. It's not suicide, but it's doing a behavior that is so risky that a person dies from it, or, a person gets seriously hurt from it. And right now, those numbers are so high, and death by despair is the highest that it's ever been in history. So the key here that I really want everyone to hear is isolation is not good or healthy. And talking about the stress and understanding it, that it's real, it's normal. Everybody's going through, low tolerance of stress and frustration, edgy, moody. They need to just vent and complain. It's okay to do that. And if you live alone, get on some meetings, via Zoom, make, time with your supports via Zoom, phone calls. Don't stop the connecting, because that's what's going to help you to stay healthier emotionally than if you just, busy yourself with tasks, which has been a common thing during this pandemic.
What are your thoughts on the state allowing liquor stores to stay open from the beginning stages of this pandemic?
Oh my gosh, you guys are having great questions. I had a mixed response, because I treat veterans. I'm a specialist also in PTSD. And when I treat a veteran who is in a war zone, I don't mess with their coping mechanisms too much during a pandemic. During a war, because they truly are in a war zone. If we were going to close these liquor stores, we would have to have a plan B for substance abuse to be able to help people for what was going to go on, because not everybody thinks that they're an alcoholic. Not enough people understand what substance abuse is. And so if we would have shut them down, we would have had another crisis in substance abuse, in which I don't think the field would have been ready for. I think logically, we go, why would we do that? But being in substance abuse as long as I've been, I had this reaction of, oh my gosh, it would be like heroin addicts not having their methadone. And the clinics just shutting with no plan B, no other supports to say, hey, listen, we've got to be ready for what's going to happen to these people who have a serious physical addiction to alcohol and to drugs. You can't quite see it as a black or white issue. You really have to see it as a gray issue. And it's something that my field really needs to take a look at, as far as, if that were to ever happen, we have to be ready for that, because people are going to be physically sick. The withdrawal that they will go through is very, very serious. And people with stage 3 alcoholism, they are at medical risk. So we would have to plan much better. And our field, I think, is really trying to take a look at that and say, okay, what do we need to do to get on the front lines of what's happening to people?
On the other side of that, you spoke about people in isolation. They need to keep those lines of communication open. They need to be able to vent their frustrations. Yeah. One of the things we're seeing in our society right now is the polarization of politics and the racial issue, to the point where a lot of people feel like maybe they can't have those conversations and they can't talk about some of the things that may be their triggers. What advice would you have for people going through that?
Talking about fear here. And, you know, it's so important to break through it. Don't get so afraid you're paralyzed that you don't talk. When you have to talk about an issue that's really uncomfortable, I teach my clients, say that to start. Say, I want to bring something up. I'm shaky. This makes me feel nervous, but I need to express it to understand it. If I'm stating something that's ignorant, please forgive me for that. I am trying to learn. I am trying to grow and go forward. We have to have the hard conversations, whether it's about substance abuse, whether it's about racism. We have to get uncomfortable to master what it is we need to master. And I teach clients how to master getting uncomfortable, how to master not knowing how to do something, because that's not the problem. The problem isn't the problem. The problem is how you handle the problem. And so I share with people, having those hard conversations, preface that. Say, wow, you know, bringing this up makes me shake. I'm so nervous. I don't want to offend somebody, and yet I'm struggling with this. Let them know, because the listener then will go, oh, okay, they're starting from a place of ignorance. They're starting from a place where they don't know. And they're going to be more supportive. If somebody does not react, if they come back at you in judgment and come back at you at a harshness, that is not a reflection of you. That is a reflection of their struggle. And so the other part that is so key is, don't personalize a person who is insensitive, or a person who has their own ignorance, or a person who is narcissistic and self-centered and judgmental. Don't personalize that and put it in yourself and say, this defines me, because then you will always walk around afraid to talk, and you don't want to be in that place. You learn who you have in front of you by being vulnerable, having needs, wants, and feelings. You want to know who you're dealing with. And if a person takes that vulnerability and judges you, that defines them. And you want to know that they're that type of person. You want to be aware of that person. And the only way you're going to find out who that person is to have some vulnerability. I think that is so key, is again, to learn how to talk about it, not talk about it or not, to learn how to do it in an effective way. And that is what is so important for people, because we have to start having these really tough conversations in order for things to grow and change and get better. And that's also the key to good mental health, is don't isolate, and talk, and learn how to get uncomfortable effectively.
Marigrace Randazzo-Ratliff, a substance abuse psychotherapist, with us on the Oakland County Megacast on a family of TV and radio stations, including 89.3 WBLD, Orchard Lake, West Bloomfield, Kego Harbor, Sylvan Lake, 88.1 WBFH, Bloomfield Hills, and WAHS 89.5 Avondale Community Radio. That is 89.5 WAHS Auburn Hills. So, Marigrace, on that note, coping mechanisms are so key, but timing is just as key as those coping mechanisms, because if they're coming into play too late, they're not going to be as effective, and if they're not coming in at the right time, they're not going to have the right effect. So in a situation of pandemic proportions, where there's all those added stresses, what are some of these common coping mechanisms that you are helping install in people that you're seeing battling addiction and those that you are treating that are battling other mental health issues, because it's going to be different in each of these situations, but there's something relatable to the general public in each of them.
Well, I think, one coping mechanism, especially if you're dealing with substance abuse, is don't stop your meetings. I hope you have developed a community of support that you can turn to, people that get it, that when you start to talk, they're nodding their heads and saying, oh, I got you. I understand what you're going through. And these meetings are on Zoom. These meetings are on the phone. If it isn't substance abuse for you, really get to know, do some homework on self-help and support groups. Of course, therapists are highly trained and highly effective and can help you as well. Good friends, whatever it takes, make sure you're doing regular check-ins every week with people. At least several times a week, you've got somebody, either you're grabbing the phone, you're going to a park, social distancing, talking, venting, define it, sit down and say, hey, I need a, complaint session, and I just want to vent for 20 minutes. I just got to let go of some crap. And then do that, get it out. Second thing, please, and whenever I say this to my clients, I get the eye roll a lot of times, but journaling, and my type of journaling is write as fast as you freaking can. Just write as quick as you can. Get whatever stress is in that subconscious that you might not be fully aware of, just out of it. You will sleep better when you let the stress and energy out of your body and don't keep it in. You will feel better and you will sleep better and you will have more tolerance of children or the wife or the television, whatever it is, the politics. You will then make the space inside to be able to cope better. If you are an overeater, if you are an addict, I say before you walk toward whatever it is you're not supposed to be walking toward, step away, go outside, sit in the car, make a phone call, grab your journal, buy time. The key to addiction is there's an impulsivity problem. And I need everyone to know, slow down the darn pulsivity. There's an adrenaline to pulsivity where you're in the middle of the act before you realize, you drank a 6-pack. You've got to slow the adrenaline down, physically move slower so you can think about what you're doing and then think about the outcome of your choice. This is so key. Those are 3 key tips that I want people to understand. And, self-help books are there. Begin educating yourself. Don't just become a lone soldier with whatever the issue is that you're dealing with, because that will make things much worse. And don't be afraid of finding out what your problems are about. I have this thing that I say, I do a podcast and I say, don't let your crap control you. You take control of your crap and fall in love with it, because you can take that crap and turn it into treasure. Just don't be afraid to do it. And my last tip is watch shame. Shame cycles are really common. You've made the mistake, whatever it is, the blow up, the drinking, whatever it is, you're in this down period after the mistake, you feel like crap, you're beating yourself up. That's the worst thing you can do. Because when you beat yourself up and you're hard on yourself, it then will send you into another spiral to go ahead and act out again. You've got to stop it. You have to say to yourself, you have to be a good parent, I always say. Be nice. Say, oh, okay, you know what? I messed up. I must be going through a lot right now that I did that. The stress must be getting to me more than I thought. I need to talk to somebody. And talk to somebody, whether it's a hotline, again, AA, Al-Anon, ACOA, which is Adult Children of Alcoholics, whatever the support is you need, get get online, Google it, and get the resources to you, because it's not that you're this bad person. It's that you're so overwhelmed, and so many of us are right now. There's been so much negativity and so much hard stuff. It's got to go somewhere. Don't keep it in the system. Get it out.
Marigrace Randazzo-Ratliff with us. She's a substance abuse psychotherapist on the Oakland County Megacast. So, Marigrace, on that note, you mentioned a lot of these resources that you turn people to, in addition to being your client or being a client of somebody else. For those in our community that are battling substance abuse and are battling other mental health issues that maybe don't have the ability to connect to these resources online, or be able to get easily to a telephone and make these phone calls, or be able to have access to a psychotherapist like yourself, what can they do in this situation? Because I think it would be, and this is just my own conjecture, it would be a lot tougher for them to deal with these issues than it would be for someone else that has those resources in place.
Yeah. So start talking about it, because when you start to share with friends or people around you, they're going to start giving you connections. Oh, I know somebody. Oh, did you know that there's an AA meeting at the church around the corner? Did you know that there's an Alano Club on Miller in Ann Arbor? Did you know? Start talking to people. It helps. With substance abuse, a lot of their meetings are hosted in churches. Now, they are not affiliated with a specific church or denomination, but they are hosted. Alano clubs, if you ever drive by them, they are key places where they hold all the different forms of support groups. Start to talk, start to be aware. Believe it or not, some of these things, the old school way, are also hanging in the grocery stores. They have the bulletin boards. They will post things there. Newspapers, if you still get one, it's the information is there. The key is start talking and asking questions, because you will be amazed. Hairdressers are amazing resource guides, believe it or not. Just start to talk and get connected that way. If you do have the internet, of course, you've got the resources at your fingertips. If you don't, and you feel like, oh my gosh, what do I do? Start picking up, each community has a resource guide, at least it used to. The Ann Arbor Observer used to be, pages and pages of different types of support groups. Get a hold of those guides, because it's all in there. Just get yourself willing to go and look, and stop yourself from giving yourself all the reasons why you can't, which is, and this is what I say to my clients, it's crap, people. It's crap. Your mind's doing a number on you, and you've got to stop it. So don't be afraid to talk, check, and get yourself connected. And, meetup groups right now are huge. And there's a meetup group for everything, whether it's depression, MS. Hospitals are another great resources. If you call a hospital and say, I'm looking for a support group, if you call any outpatient clinic in your area and say, look at, I'm pretty isolated, I don't have the funds, but I'm looking for a support group, we will share that information and appreciate it. There are hotlines if you're feeling really desperate, suicidal. There's the suicide hotline. Call. Do you know that hotline calls are 10 times what they were before the pandemic right now? That's a lot. But you can call and get help. And I think once you make that step, you are going to feel so much better, a little bit at least. And it will help you to make the next step. So they're going to tell you where the resource is, or if they're on, a phone call, you get on the call. Usually with any support group, they have a key person that is the contact person when you're new to the group. You call and that person will answer, and you say to them, I was so scared to make this freaking phone call. I didn't want to. I was fighting it, yet I know I have to do this. I'm going to just make myself do this. Number one, they're going to get it. Number two, they're going to connect you with somebody. And don't stop trying.
Marigrace Randazzo-Ratliff with us. She's a substance abuse psychotherapist with us on the Oakland County Megacast. Before we let you go, anything else you'd like to say today?
Oh, please, 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 people, don't isolate. And please know the stress is real. It's real for everyone. It is not unusual. It doesn't mean that there's something wrong with you. If you're getting tripped up, so many people are getting tripped up. You are not alone. Don't be afraid. Don't be ashamed. There's a wonderful book called Healing the Shame That Binds by John Bradshaw. I highly recommend it for people who guilt trip themselves or beat themselves up. I hope, they'll check that out. And it can be very helpful, because I think shame and isolation are the two key things that really keep people in anxiety or self-medicating, anything that isn't mentally healthy.
Well, Marigrace, thank you very much for being with us today.
You're welcome. Thank you guys.